Ladies and gentlemen, please welcome Nicholas J. Webb.
40 years ago, when I started in healthcare, I started as a medical technologist. One of my first innovations was one of the world's smallest medical implants for the treatment of ocular surface disease that installs into the vertical puncta. And it was interesting that back in those days, if you developed a technology, you would expect it to last, 16 years. Right now, most medical devices, are 16 months. Right? The lifespan and the life cycle has really collapsed. So we have to invent much quicker. We also have to invent bigger things. And we need to leverage digital ubiquity, connection architecture, enabling technologies to really invent things that ultimately impact the quality and access to patient care. And I'll give you some examples of that today. Now, the problem is, and it's a real problem, and I sense that it might be one here as well, is that we have been trying to fix the broken healthcare system through incremental innovation. Since there's a lot of savvy investors in here, I'll give you the investment analogy. When we look at innovation, we want to invest in incremental innovations that provide a small yield. But we also need landmark innovations that provide higher degrees of risk but higher yield. And then we also want to invest in breakthrough innovations that provide even greater opportunities with a proportionality of risk. But you'll see today that the real opportunities, in addition to having this balanced portfolio, is to also invest into disruption. And the best way to look at disruption, I think Picasso described it best, is that disruption is really about destruction. It's about destruction, right? In other words, he famously said that every act of creation is first an act of destruction. I believe that when you look at well-developed healthcare systems that are emerging around the world today, these beautiful innovations are coming after they clear off the ashes of the destruction of a legacy system and they create completely and total new models. What's the trajectory look like? Here's the problem, is that when you talk to most leaders in the healthcare bureaucracy, when you talk to most people who own the decisions in healthcare, they are just starting to believe that change is coming, even though massive disruption is happening all around them. Then eventually, they start to deny it. And I find that one of the common symptoms of denial is that they have this sort of hyper-internal focus. They try to rearrange the deck furniture on the Titanic. And then they go through, in other phases, like they'll start the process of thinking about hiding from it. Again, that's usually about looking at different policies and a restructuring of a system that is not savable in many cases. Then, of course, one of the problems that we see in North America is they blame the government. They blame third-party providers. They blame regulations. They blame everything except the dysfunctional system that they authored and believe in and that, frankly, have doubled down in. Eventually, disruptors and losers all get to the point of realizing that massive change is happening. Both of them realize that. But it's not until they actually embrace it, to understand the DNA, the molecular structure that makes up disruption, and leverage and use its incredible superpower to do what we intended to do in healthcare in the first place, and that is to impact the quality of life. So how do we get there and where are we going? So if you think about the trajectory of intervention, 500 or 600 years ago, we started to invent healthcare by delivering first aid. We were able to keep people from bleeding to death for the most part, and we could mend bones. That's really how we started the process of the industrialization of healthcare. And then, we made some amazing advancements during the way in which we addressed infectious disease. Really an incredible time in healthcare. We invented antibiotics and we invented vaccines. And the positive impact that this had in terms of eradicating death and suffering is really incredible. But it emboldened us to create modern medicine. Now, modern medicine, unfortunately, in many ways, was an economic model that was created that rewarded intervention. Modern medicine paid me as a medical technologist to invent stuff I got paid for, right? So in fact, when we were looking to invent medical technologies, the first thing we would do is look to see what the third-party reimbursement structure was. So we're not looking at human suffering, we're not looking at any of those things, we're looking at the economic model. And as a result of this, what has happened over the last 30 and 40 years is we have increased the cost of healthcare. In North America, it's increased by 5 times, and yet we have the sickest population on the planet. In fact, this may not be shocking to you, it is to me still. 70 to 80% of every dime that we spend on healthcare, think about that, 70 to 80% is self-inflicted chronic disease. 90% of type 2 diabetes is caused from lifestyle, right? Cardiovascular disease, 80% of it is caused from decisions we make. The majority of the real problem in healthcare is self-inflicted chronic disease. In fact, we now call this category lifestyle disease. Now, what's that number here? Well, I'm not sure I was able to find a really solid number on that, but I suspect that it is not as high as it is in North America because we're incredibly unhealthy. But I suspect that there is some number that would be of interest, right? So we've created hyper-interventional behavior to where all we do in the healthcare machinery is look at ways of intervening and intervening. The problem is when you take a look at the epidemiology of chronic disease, the cost, and you look at an aging population, in North America, 1/3 of all Americans will be over 65 years of age by 2020. You have a point where it is absolutely impossible to deliver reliable, safe, predictable healthcare without going to the core causality and without fixing the dysfunctionality which exists in all developed countries. You've got to fix that stuff. So here's where we are going, in my view. We are going to make an amazing shift from diagnosis and treatment to anticipation and prevention, because that's where the economic opportunities are. It's also where the humanity is. This is where the humanity is. This is where we get to do the poetry of not just improving the economic dynamics of making healthcare affordable, we also at the same time, in one fell swoop, significantly improve the quality of life. In fact,